For my last talk, I'm going to give a talk on body contouring innovations with an injectable medication, salmeterol and folate. And obviously, I talk about this a lot, the idea that we're all aging, we get UV exposure, but the most important cosmetic organ is a toned body. The days of a toned body, I'll tell you. It's way back there. We all want to get rid of the fat, but adipocytes are a part of a complex system, as I talked about. We want to turn back the clock. I was able to put up a picture of myself up here just to show you that I wanted to be fully out there. But we do have areas that we want to lose some fat. There's no question about it. And what's the ideal treatment? Effective, safe, easy to master, low initial investment, FDA approved. You're going to hear about another from Gary Monheit, another injectable that's actually going to be coming on the market very soon. That's very exciting, ATX-101. So we're going to look more and more about these injectables. Dermatologist friendly and probably combinations. And here are some examples of the different types of treatment we could use: cold, mechanical heat, chemical deoxycholate, which you'll hear about in a little bit, salmeterol, I'll just say SX for everybody, which is LiPo-202, and I talked about low-level laser therapy. So there are many different ways of doing this. LiPo-202, the salmeterol, is a long-acting beta-2 adrenergic drug and enhances the body's natural metabolism of fat, leading to a decrease in fat cell size and volume, but not death, leading to localized subcutaneous fat reduction that appears to be for a long time. These are once-weekly injections using a 30-gauge, half-inch needle for 8 weeks, with results seen in a month and peak at 2 months. And this is just showing that you get shrinkage of this fat cell by this mechanism here. So you inject long-lasting, we target patients in the study with a stable weight, not obese, but with areas of fat that they really don't like as they get a little bit older. I'll leave it at that. The phase 2 studies are complete, and this is really the phase 2 study that we were involved with here. It was a dose-ranging study to look at the differences of the different dose and look at the endpoints. This was very accurately measured, and this is just showing you the idea of the measurement. And this is the change in the circumference and the umbilicus here over time. Remember, we didn't treat the whole circumference here. We just treated the front. So you're getting some changes in the circumference, thank you. Even though we're just treating the abdominal area of about 1.5 centimeters here with just this study. And what we found here is that the low dose, 0.4, tended to work the best, statistically significant at that point. This is the change in the volume calculated by the tape circumference, so you can actually figure the volume here from that perspective. And this is the estimation versus what is published for liposuction, and it's very, very similar for that aspect there. Here's some examples, and remember, these are not obese patients, but the idea here is to take down the area of fat that really couldn't go away with diet or exercise, and really targeting that aspect, and you could see that on these treatments here. So the nice thing is there really aren't much in the way at all of adverse effects. There was injection site hematoma was very, very mild. That's from the injection, basically, not really from the injectable, so to speak. And what you can see here is really there was no significant difference between the placebo and here, really in any of the categories. There wasn't post-injection pain or anything along those lines. So largest key findings from this study, and this is ongoing, showed that the 0.4 microgram dose is the most effective dose, will be taken forward. Over 50% of the patients see a clinically meaningful change, significant reductions in abdominal circumference and volume, improvements in patient satisfaction. Patients who remain weight neutral in the trial have actually a magnified change, safety equivalent to placebo, and I think we're going to look at this in the future. And the summary and conclusions of this is LiPo-202 appears to be effective and safe. It is a different mechanism. It's not destroying the fat cell. The endpoints seem to be valid, and the safety is equivalent to placebo. I think that it's very, very exciting to see these new innovations. Most of these are coming out of small companies, and I think that's really exciting for us as dermatologists for the future to be able to see these very rich, very detailed clinical innovations being looked at in a very, very scientific way. And I'm very, very excited to see this and the other innovations that you're going to see today.